Good morning. Welcome to RedTape Healthcare. My name is Kurt Preuss, and today's topic we're going to talk about Medicare. Previous episodes we've talked about HMOs, PPOs, and Medicaid. Today we're going to talk about Medicare. What is Medicare? Medicare is a federally funded program, meaning that the federal government funds this for individuals that are of Medicare age. And what that means, individuals that are 65 years old or greater, or if you're on Social Security disability, or you have or end-stage renal dialysis. That's those who can qualify for Medicare. Part A basically covers hospital services when you're an inpatient and when you're in a nursing home. And it covers certain days and amount of days that you can have that service. However, most of us also know Medicare is having a Part B. Part B is for outpatient services, for when you go to see your doctor, when you go to have an MRI, you go to have lab services. So basically it's anywhere where you can walk in and walk out the same day and have services. Medicare pays on a fee schedule of 80-20. What that means, Medicare has a fee schedule, and we talked about it in earlier episodes about CPT codes and how billing is done. So when a practitioner bills out in Part B with a CPT code, Medicare has a fee schedule aligned with that. So what happens is that when the government or Medicare pays the bill, they will pay 80% of the allowed amount for that CPT code that practitioner billed. So for example, if you had a bill of $300 or Medicare allowed $300, they would pay 80%, which is $240, and then your responsibility would be the $60. However, there's other ways of managing that 20%, because for some people this 20% can be very expensive over a year's period of time, and some people then buy what is called a Medicare supplement, which would help ease that financial pain of that 20%. And with Medicare, you do have to pay a premium and you do have to pay a deductible with this particular plan. Medicare Part C is typically available in a highly populated urban area. Medicare Part C is a Medicare HMO program. So that you will see that, like I said earlier, in a more urban area where you have a large population. And so Medicare Part C is for those individuals that want to have an HMO affiliated with their Medicare program. And Medicare Part C covers all the benefits of Medicare A and B, and typically you have a few more benefits that A and B don't include. Some could include vision and dental, but Medicare Part C is a Medicare HMO program. Medicare Part D, that's your pharmacy component of Medicare. That is what you have to sign up with Medicare to get a pharmacy benefit. So Medicare Part D is your pharmacy. Now, many of you are familiar with Medicare supplements. This is independent of Medicare. Supplement typically covers those expenses that are not covered by Medicare Part B. If you recall, Medicare Part B is 80-20. It's an 80-20 plan where Medicare will cover 80% and then you're responsible for 20%. A supplement typically covers that 20% that Medicare does not cover, and that's an additional premium because it's a separate policy than Medicare. And typically you'll find plans A through N in your Medicare supplement plans. So there's several to select. Continue to watch our educational series. Join me, Kurt Preuss to learn techniques and strategies to help you save money and how to navigate our frustrating healthcare system. Remember, you do have control over your healthcare. Don't let the system wrap you in red tape. For more information or to subscribe, please visit